أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. الحمد لله رب العالمين. In the name of Allah, the most beneficent, the most merciful. My brothers and sisters, fellow Nigerians, I greet every one of you with Islamic greeting. Assalamu alaikum wa rahmatullahi wa barakatuh. May the peace, mercies and blessing be upon all of you. My presentation today we build on a particular topic known as hepatitis B, the chronic of hepatitis B, the chronicle, the effective and the widespread of hepatitis B in Nigeria. This program is not only to warn Nigerian and everyone that will benefit from this presentation, but also to look into how its occurrence, how it spread to the people, and the consequence. Hepatitis B. Historically, hepatitis B is one of the viruses known to humanity. It's one of the viruses known to humanity. It's not only the virus, it's not only the only infection, only virus on heart, but to our own experience and research, hepatitis B is one of the most dangerous viruses on heart. Is killing everywhere. Actually, HIV is a virus also. Meanwhile, there are some solutions that can tame down the side effect and the consequence of HIV. I can say it categorically. HIV patients can live as long as they want. HIV patients can live without any viral load. HIV patients can live on heart without being infected other people. They cannot be able to spread it again because there are many natural solutions. There are many things spread across the country to treat HIV patients. But hepatitis B, I want to discuss with people today, is a virus that has no cure. Is a virus that has no any medical. I can say it. The reason why I want to present this, I discussed about it long time ago, and the video went viral. Make people to be asking, "Oh, doctor, please let us know how this virus. Let us know how this virus. We want to know about it, but we can't understand Yoruba. That is why, for those of you who cannot understand my language, I want you to benefit from this. To know how to safeguard your life, you need to be very careful. This virus we are talking about is not an ordinary issue. It's not something you can look upon and wave your ear. It's beyond imagination. It's killing every day. People are dying on daily basis. Even WHO, they believe hepatitis B is the most dangerous killer on earth in this 21st century. We can't deny the fact that the virus of hepatitis B is not only hepatitis virus. Let me come again. There are many hepatitis. We have hepatitis A, hepatitis B, hepatitis C, hepatitis D. Even some medical doctor believes that there are hepatitis C, hepatitis E, hepatitis A is also a virus, but is treatable. Let me say that is treatable. Hepatitis A is a virus that occurs to a human being. When you get it, you'll be seeing some sign of either malaria fever, either chronic typhoid, cerebral malaria, something that will make you may be vomiting, you may be look fatigued, you may not be able to do what you're supposed to do. That thing may weak you down, but it's treatable. Even though some doctor claim to have treated it in the hospital. Hepatitis A, I want you to get it. Hepatitis A is also a virus, but it's not as chronic as hepatitis B. That is where I'm going. Hepatitis A is not chronic. It's not chronic. Anyway, if you don't treat it and if care is not taken, it can kill the victim, but it's not as chronic as hepatitis B. What am I trying to say? 2019/2020, the whole world was being locked down due to coronavirus. That time I came out, I wrote many papers that coronavirus is not worthy of a virus that federal government will lock us down. There is one particular virus that they're supposed to lock us down, which is hepatitis B, because the moment you get it, my brother and sister, there is no any medical assistance. If I see any doctor who will give you assistance, or who will come out to diagnose you with a particular medicine, what medical doctor will give you, they will diagnose you, they will ask you to buy some drug to sustain your life, not to fall sick. They know your liver will be busted one day, but they will give you something to sustain your gallbladder. When they give you that medical pill, try to open it and see the leaflet inside it. That pill is not meant for hepatitis B. It's for gallbladder enhancement, to enhance gallbladder. Gallbladder is a chemical container that there in your body, part of your body, a chemical to help, to assist, to look after, to protect the liver. Your liver will not die until you have problem with your gallbladder. So the medical doctor believe if we can't help your liver, we can assist your gallbladder. That's why they will give you this. Oh, go and use this. I don't want to mention any medicine, not to destroy their market. But my sister, my brother, there is no any medical solution for hepatitis B. That is where I'm going. I said hepatitis A is not as chronic as hepatitis B, because it's a virus that will make you to look as if you have malaria. That is it. You'll be feeling malaria, you'll be feeling pepperish, you'll be feeling heat, you'll be feeling inflammation in your body system. That is hepatitis A. Hepatitis A. You can even cut it through leftover food, contaminated food. Some people enter this problem because they don't know the side effect of it. Don't let anyone give you pure water. Leftover pure water. They drank it and give you the remaining. Don't drink it, my sister, my brother. You can contact the virus through it. It's spreading. It's widespreading. I'm saying this I know many people has died. Many people are there in the hospital. Many people, the doctor will send them away. Go your house, go and die there. Many people are carrying this virus all around. You will not know them through their eyes. When somebody give you pure water, remember you can die because of 20 naira pure water. Don't use their mouth to drink it. It's not that you ate them. Don't let them feel as if you ate them. When they give you pure water, they say, I don't need it. Simple. But if you take it, if the person have hepatitis A, hepatitis B, C, D, you can contact it. Especially hepatitis B. You can contact it even through contaminated food. Maybe that person use spoon and drop it. The person sneeze, you can contact the hepatitis A. But it's not as dangerous, as chronic as hepatitis B. The second one is hepatitis B. The second one is hepatitis B. This hepatitis B is a virus that causes inflammation to the liver. The moment you have it, the moment it occurs in your body, the moment they diagnose you, you went for test and they said you have it. My brother and sister, you don't need to cry. It's like you get your death certificate. I'm not scaring you. I want to create a way out. I want to tell you what you must do. I want to let you know you may not die if you take the necessary step. Not medical. It's not medical. I can say it if any doctor can come out to prove it that there is something one can use to cure hepatitis B through medical pill. That doctor can come out. I know some hospitals have this testimony. But my brother and sister, those doctors that have testimony of curing hepatitis B, they can't say it outside what they use, but they are using ABA. The composition of ABA. I think people will understand what I'm saying. They are using ABA medicine. The only solution for hepatitis B is ABA medicine. Where are we going to get it? Who will procure it? Who will provide it? That is where the problem lies. I said it again. Hepatitis B is a virus that causes inflammation, heat on the liver. The moment it enter your body, the mission of hepatitis B is to go after your liver. It doesn't have any problem with other part of your body, but your liver. And this liver is the only organs in the body that when anything tamper it, there is no repairer for it. You can't change it. There is no any transplanting. There is no any transfusion for the liver. Because of what? According to Al-Quran, I don't want to go to Islamic perspective of it. I want every one of you to, irrespective of your faith, I want you to know. But according to Al-Quran, or according to the medical theory, there is something called the oxyribonucleic acid. This acid, DNA, is a chemical, is a kind of microchips that contains you. A microchip that contains you, a chemical that represents yourself, and this, the oxyribonucleic acid that make you to know your baby to reflect, your character to reflect on your baby, is this DNA. And this DNA contained in the body, in the liver. The liver contains the oxyribonucleic acid. Many doctors deny it, but I'm telling you the truth. That is why they can't change it. The moment they tamper your liver, you will not be as you be before. You will not be yourself again, because that DNA will change. That is the only way you can change your DNA. Transplantation of liver. Hepatitis B. When it enters your body, its mission is to destroy your liver. Its mission is to destroy your liver. Please, if you see this program, I want you to help us to share it. I'm saying this because a lot of question has already been sent in front of me. I'm not the only one, but people just want me to say something and they believe whatever I say, because I will never lie. If I tell you this, it is this. If I tell you that, it is that. Help us to share it, to invite people to see the truth. Those who have it, how are you going to go out of it? Those who don't have it, I want you to know how to preserve yourself, how to come out, not to be infected. Look at how they prevent us from getting coronavirus. Those who have it, they ask everyone to be using nose masks. They tell us how to prevent ourselves. But this hepatitis, I want to tell the whole world now. I'm speaking English in order, a lingua franca for every tribe to understand what I'm saying. You need to preserve yourself. In 10 years to come, this is in Skola Islamic Foundation, there is a theory we call vision 10 years to come. Vision 10 years to come. In 10 years to come, there won't be anybody to donate blood in hospital again. Because of what? Because of hepatitis B. Because of hepatitis B. As I'm talking to you right now, you can go to WHO to get the data I'm talking about. In every 11 people, in every 10 people, there must be 7 out of them that they might have hepatitis B. 5 of them has already been known. Why some of them they have it but they didn't go to hospital to test it until when the problem arise, when they wanted to donate blood, or when maybe a woman want to have pregnant and they want to start this thing. Hepatitis B. In the light of this, no one will deny it. I'm saying this because some people will say, hello, they said I have hepatitis B. I will say, oh, please don't joke with it. The life needs you. Your family needs you. This hepatitis we are talking about does not know the rich, does not know politician, does not know the king. Whatever you be in life, if you have hepatitis, you are a victim. And the problem that has no medical solution is a problem that your money cannot, you can't use your money to reflect the solution. Many people run to abroad. They will send you back to us, or else you will die obnoxiously. Hepatitis B, I know it has already been spread beyond imagination, to the extent that in Nigeria nowadays 70% of Nigeria has have it. One of the professors says that it's beyond 70%, but we agree, let us say 70%. In every 10 people there must be 7 out of 10. Even you may be feeling ashamed, but I used to tell them, don't feel ashamed. This is your problem, this is your life. You need to carry it, you need to prepare it. Don't let people scare you away. It's a problem, it's a problem, it's a fact. Look for a solution. Look for solution. Don't silent with it, don't keep it to yourself. So, not to digress, we have hepatitis A. I said that one looks like malaria, but it's a virus. It can kill you if you don't treat it, but it is treatable. Hepatitis A is what? Is treatable. You can treat it with guarantee. It also have, hepatitis A also have medical solution. Some doctor can get it. I mean, some doctor, not all. Some doctor, especially those in virology or something like that. Hepatitis B is the problem of the liver. There is hepatitis C also. Hepatitis C is also a virus of hepatitis that contain an inflammatory ink to destroy your skin. It's a kind of dermatological disorder, something that all the dermatologists will look for and they will not know what happened to your skin. That is hepatitis C. It can make your body to eat. You may be feeling it. Especially it will destroy your hormone to the extent that your hormone system will be infected, and you may be feeling it during the cold. You may be feeling cold during the heat, because all the flesh, the epidermis, the outer layer of the flesh that is there to watch over all your problem has been dead. This virus has killed it. So that is why you will be having such problem. That's hepatitis A. Hepatitis C, I mean. Hepatitis C is a virus that inside your body to destroy your skin, to cause a problem to your body system, your body structure, your flesh, your hormone system. Even there are some doctors that believe hepatitis C is one of the symptoms of lupus disease. Lupus, L-U-M-P, lupus is one of the symptoms, because your hormone, it will make your hormone to fight itself. That is hepatitis C. But all those ones are less concerned. I know what I'm saying. I'm saying this from my practical experience. I'm saying it from practical experience. And I know how it works. I know how it's killing people. We can't count the number of people that die with this virus. So that is why I want to focus on hepatitis B. I have seen it. I've tell you the division of hepatitis. Now we want to focus on hepatitis B. What is hepatitis B? Hepatitis B is a virus. That's inside that infected your body system to destroy your liver. Nothing else. Meanwhile, when it's inside your body, you may be feeling some symptoms such as yellow eyes, such as your urine will turn to yellow, after it will turn to dark, such as inflammatory body system, such as consistent malaria. You may be feeling all sorts of things. That's hepatitis B. And what I also want to discuss is the division of hepatitis B itself. There is two types of hepatitis B. Two types of hepatitis B. Because this is causing a lot of problems. So I am trying to take it one after the other. We have chronic hepatitis B and this chronic hepatitis B is a division of hepatitis B that will turn your body system. You will be having a factors, you will be seeing a symptoms. That is chronic hepatitis B. The second one is reactive hepatitis B. What is the difference? Chronic hepatitis B and reactive hepatitis B. Reactive hepatitis B is a form of hepatitis B that will not reactive. It even the viral load will come down. It may not be up to 100. It may be between 1 to 50, or you may have 0, but they will say, oh, you have reactive. Some people will say, oh, they said it's not serious, it's reactive. It is serious, my sister, my brother. It is serious. Because of what? The active hepatitis B is most dangerous hepatitis, because you will overlook it, and that thing will be able to hide into your liver. All of a sudden your liver will burst and you will die. And you will die. That is why they said reactive hepatitis is the most dangerous hepatitis. My brother and sister, I'm trying to let people understand this in order to run away and to preserve yourself from getting it. If you have it, how are you going to save your life? That is the second major important significance of this presentation. We can't run away from the theory. I said it again. There is chronic hepatitis, which will make you to have the symptoms such as the color of the eyes, color of the urine, your urine will change, your eyes will change, and you'll be feeling the pain in the right side, a kind of sharp pain in your right side, because your liver has been punctured. That virus is like a moving object in your body, but you will not feel it until it gets to your liver. It will puncture it and the blood will be coming out. The reason why your eyes change and your urine dark is that there is a leakage in your liver. Because of what? Because of what? All the water and the blood in our body will go into kidney, and the kidney will filter it. It will return the blood into your body and filter away the urine. That means your kidney will not make your urine to dark. There is a leakage somewhere. After the work of the kidney, the blood will now come to join, to be leaking into your liver, to be leaking into your bladder. God. Allah Akbar. Hepatitis B. My brother and sister, when it happens that you have it, you can never go away from the fact, because it is there and no one can change the theory. As I was saying it, no one can change the theory. So now my mission here is to let every one of us understand the effectiveness and the side effect of hepatitis B. Now, another major factors that I want to discuss. Please, if you see this program, I want you to share it. A lot of house has been destroyed because of hepatitis B. In what way? Some husband will not have it and the wife will have it. How is that possible? That is some of the question we used to answer in Skola Islamic Foundation. Is it possible for wife to have hepatitis and the husband will not have it? Is it possible? Is it possible? If I may say, it is not possible. Those people, hepatitis problem, hepatitis virus It's not a disease from God. I want you to get that straight to your head. That is why I used to tell people that this virus does not have any spiritual inclination. Don't say somebody is killing you, somebody is this, somebody is after your baby, somebody is after your life. It is hepatitis. It does not have any spiritual inclination. It's not a disease from God. I want you to get it straight. I want you to know that it's not a disease from God. It's a disease designed, originate, coordinate, manufactured by some people. And their mission is to depopulation the world. Their mission is to reduce the number of people that will cross to their town, their country. They want to send you away. They don't need you anymore. In order to send you away, there is no way. There is a kind of interlink. There is a contract that interlink on the country. They don't have any right to send you away, but they are looking for a way to send you away. That is how they created this virus. And they want to depopulation the world. That is another fact. They want to depopulation the world. They said, we are too much on heart. Let us kill some people, they will die, and we will know the number of the remaining people. That is how it all started. Those people that wrote the program of hepatitis B, they wrote it like a program, like a computer. They wrote it like a computer program. And their mission, when they wrote it, they believe there is no way you will have contact with those who have hepatitis virus without contacting it. It is not possible. You can ask Google, type it on Google. Is it possible to contact anyone with hepatitis B without contacting it? They will tell the Google, no paper on Google, no paper on social media. No medical doctor will say it is possible for you to have contact with hepatitis patient without contacting it. No paper. If you see that paper, please put it on this page. Let me see. I want to know the writer. I want to know the writer. So if it is not possible to have contact with hepatitis patient without contacting it, how does it happen? The wife will have it, the husband will not have it. This point is a secret, but I want to expose it because innocent spouse, I can't say husband, I can't say wife, but spouse, it may be wife, it may be husband. Sometimes they may be innocent and they will be the one to die of this problem. In what way? There are some blood that no virus will appear in that blood. It will be inside that blood. Aside from being in your genotype, I'm AA, I'm AB, I'm O, in your blood group. You may be whatever you think you be. That is not what I'm saying. But there is something called blood results, the factors. Maybe you are positive or negative. You may be O, and at the same time you will be zero. You will be plus, or you will be negative. Some of these formulation of blood morphology cannot allow the concept of virus to appear. They will not see it in hospital and you have it. You will now become the object of the formula to spread it, but it will not be in your body. So one of the it happened in one town like that. The wife was crying, "Hey, Dr. Skola, please help me. They said I have hepatitis B. In that regard, my husband sent me away. My husband said he doesn't want to contact it, and he sent me away." Now I ask, since when have you been nursing this problem? She said since 2 years ago, when she wanted to deliver a baby. I said, okay. Since then, do you have sex with your husband? She said yes. Forget about it. It's inside your husband. Your husband might be the carrier who infected you. Okay, tell your husband to go and do test. The husband said, since I don't have it, I will not do test. And some of the husband will do the test and it will not be in their blood. It will not show. Since you have sex together, you have it in your body. But I told you the type of hepatitis is two. One is chronic hepatitis, the other one is reactive. It may be reactive hepatitis in your body, but when you spread it, it will appear in the blood system of other, but you will not have it in your blood, but you can be the object to spread it. You may not understand. Some of medical doctor disagree with me on this. Oh, Skola, we don't like what you are saying. This is not so. It's not so. It's not. I said, I have an encounter with somebody that has HIV. He doesn't have it in the body, and he spread it to 10 people. 10 people contacted from him, and he was negative. So those doctors begin to ask the question, is it possible? I said, it is possible. The way Almighty Allah created us, we are different. He said in Al-Quran, in Saya Kumula Shata, your personality, your prerequisite, your tenacity, your character, your attitude, your prerogative is different. What will kill you, some people will swallow it and they will be living. So, I want to tell you this as a secret. If your husband has hepatitis and you go to hospital, they said you didn't have it, don't deceive yourself. It is inside your body. I'm not the one who said it. I'm just revealing to you as a friend, as a brother, that there is no way you will contact an hepatitis virus patient without contacting it. There is no way. I know people who understand what I'm trying to say. If you are treating yourself, make sure your husband is treating himself. If your husband is treating it, make sure you are treating it. Because of what? Those people who wrote it. I'm referring to those people who wrote the program. Those people who originated. Those people who have the plan to kill us. Because we have started, we went ahead to prepare the research on how to cultivate the problem of hepatitis B. We constructed the first research, the second one, the third one, the fourth one. In the fifth one, some of our professors said you need to stop it here. That was 2017. We need to stop it. I begin to ask questions. Why are we going to stop? They said they will kill you. It doesn't make any sense. Who are they? That is the question I'm asking. They will say there are some days somewhere. This day I'm talking about are the people who wrote the program, are the people who sent it out, are the people who spread virus like HIV, virus like coronavirus. It's not a disease from God. It's not a disease from God. Some people wrote it. Who are they? We don't know. Go and ask Google. Do empirical research. You will see a lot of things. It's not me. What I'm saying is on Google. So now, my question is this. Those people that spread it believe that you can contact hepatitis B not only through sex. I want you to get this another point again. When you have a contact with HIV patient, there is a way you can have sex with HIV patient without contacting it. If a man have HIV and the man cohabitate with a woman, that woman has 100% to have that HIV. But if a woman has HIV and cohabitate, have sexual intercourse with a man, that man can have a sex with you without condom and he will not contact it. I can't count the number of HIV people we have. We have different experience. It is not possible for a man to contact HIV from a woman, except if that woman deliberately wants to spread it. In what way? If that lady shave the pubic ear on the over the vagina, because that ear can cause a cut to the penis, because those people who spread HIV believe you can only contact it through blood contact. A woman with HIV virus, they have their breast milk as that virus, their hormone system as that virus, their blood as that virus. If you contact any of it, you will contacted it, you will have the problem. But that virus is not in their vagina. The virus is not in their vagina. The virus is not in their lips. You can kiss them. Mind you, when you are having a cohabitation, a sexual intercourse with HIV patient lady, you are cohabitating. You know, if you don't dig, maybe you did not dig to the extent that that lady will have a blood arrangement in the vagina, you will not contacted it. But those people that have sex with a lady and contacted HIV, they can only get that through two means. Maybe you suck the breast. You suck the breast, and the breast have water. I mean, there is milk. If you suck it like that, you will have it. That is one. The other way is to have a kiss to the extent that some lady will deliberately have a wound in their in their lips. So when you are kissing, you will take the virus in. That is the second way. The third way is to have the sex until that lady have a sweating blood in the vagina. That is it. So if you have a condom, you use a condom, you did not suck the breast, you will never contact HIV. They are married, they are getting married. God bear me witness with what I'm saying. They will marry. What I'm trying to let federal government understand is this: HIV, those people that wrote HIV, those people that spread it, they produce a medicine for us, and this medicine, they said this HIV can kill you. We are the one that produce it, but this is the medicine to cure it. This is the medicine to manage your life. That is why I said to HIV patient, it doesn't make any sense. I don't want to digress. Let us face this hepatitis B. The reason why I made mention of HIV is because when you have HIV or a man want to have sex with HIV, you may not contact it. You just have only 10% probability of getting it. But if you have an hepatitis B spouse, or you have a sex with hepatitis B patient, you have 99.5% you will contact it. It's not only through vagina. The water, the sweat, the sperm, the contamination of the sperm, the congestion of the sperm between you and that lady will cause you to have the virus. Their water, their hormone, their sweat, their saliva, you can contact the virus through it. Even if you have condom, the use of condom cannot protect you from contacting hepatitis B virus from a lady or from a man. Don't deceive yourself. Stay with your wife. Stay with your spouse. Don't kill yourself. Look at where you are coming from. Look at how you get your education. Look at how you get job. Look at how you get all the property you have. Look at it is time to enjoy your property. You now destroy yourself with 5-minute enjoyment. I know what I'm saying. This virus is everywhere. All those ladies that they were doing Olosho, many of them they can't go to hospital to do tests. Some of them knew they have it. They say, what is it? Let me go and doing it. You are having a street hawker. a lady on the street hawking the vagina, offering you to have a free sex, offering you to have sex and pay, offering you to become olosho, offering you to become godfather, that is what will kill you. Don't eat something that will kill you. That is another significance of this program. Stay with your spouse. Enjoy yourself. Enjoy what God ordained on you. That is where God wants you to stay. Stay. If you want to marry another wife, make sure you do the test. Look at this Islamic teaching. Look for a test if you want to marry another wife, because you should not cause problem to the other wife in the house. You do the test for the person. Do HIV, hepatitis B. This is in line with Islamic teaching. The Prophet said, "Isa semiton bitoun bihariden." When you hear that there is a virus in a particular place, don't go there. And if the virus is inside you, don't spread it. That is Islamic teaching. Now, some people will deliberately say, "Oh, I will not be the one to go down. I will not die alone. I'm going to kill other people." Continue. God is looking. So those are the messages I want you people to understand. Hepatitis virus is a very, very real. Is a very, very real. When you have it, what is the way out? I told you the manner, the factors, and how it is spreading geometrically is because it's not only through the blood, it's not only through the sex. Even if someone just spout out their sweat, if it match you, make sure you clean it very well. It may contain a virus. Don't die. Don't feel shame. When somebody gives you a leftover food, a leftover pure water, a leftover bottled water, or a drink nowadays, don't take it. Don't take it, or you clean the cup. Just clean it a little bit. You can use your cloth to clean it. When somebody gives you pure water, half of it, where the person suck the pure water, hold it and dig your own in another place, because there are virus everywhere. Many people don't know they have it. They don't know they have it. Another point of view. This virus does not have anything to say about the time factor. Oh, I just caught it just last month. I just caught it just 1 year ago, just 3 months ago. It doesn't have anything to do with that, due to the factual experience I have. The quantities of virus in that your body will determine how long you will live. And this viral load, the quantity of that virus in your body, does not mean how long you have it. What we experience and what we understand is this: if you have the virus and you have 10,000 viral load, if you spread it to somebody, that person will start his own with that 10,000. That is where the problem lies. I have a patient that have that virus since 2015, and his viral load below 40. And I have somebody who caught the virus during the lockdown. He has just 2 years. He has more than 22,000 viral load. I have somebody who contacted this 2021. His viral load beyond 120,000. I have someone who contacted it. He traveled, he escaped the lockdown, and he traveled down to Nigeria. That means early 2019. His viral load is 1,274,000. Now, he's about to die now. So this virus does not determine the time factor does not determine the quantity. You can't determine the quantity of the viral load because of the time. The lifespan. They may say you have it and you will have viral load of 10,000, 20, 50. And this virus determines how long you will live. That is what I will say. Because when they overwhelm your blood, they will flow into your liver. Your gallbladder will try to kill them. Gallbladder has the chemical to protect the liver. Bilirubin and gallbladder, they are almost together. Bilirubin is a chemical to change our food. It's a chemical to dissolve our food. It's a chemical to help the food to dissolve. But gallbladder is a chemical to help the liver. When this virus is flowing in your body, it may not reach your liver, but your gallbladder will be killing them. But the capacity of this virus to procreate is more than the capacity of the hair. It's more than the capacity of the insect. Someone might have just only 100 viral load today. Within a month, you can have 100,000 viral load. How are you? Who are the people that created this virus to kill us? I pray to God Almighty Allah not to forgive them. People are dying on daily basis. Many governor, many senator. Whenever you see slump and die, slump and die, slump and die, or you see somebody that came out, I'm going to die very soon. It's not a fate. It's as a result of hepatitis. That hepatitis has entered the liver. The liver has been busted. So the doctor will just tell you, you have some days to live, some months to live. But there is a way to protect your liver. That is where I'm going. Because many people will say, oh, what is the solution? Leave the story. I'm not telling you story. It may not relevant with what you need to hear. Delete the video. If you know what I'm saying can help other people, you can share it. I don't bloody care. I'm saying all this because people ask me to do it in English. I'm not only for those people that have it. I'm trying to warn people that doesn't have it. If you don't have hepatitis, try to look your back, watch yourself, watch your left and right. Don't kiss anyhow, don't hug anyhow, don't change your shirt with somebody. You can contact it through the sweat, your sweat, or someone's sweat. I can't count the number of footballers that contacted it. They will be you will see them playing ball and change shirt. You will contacted it. So that is my mission. It's very, very clear. So what I'm saying is this. Let me summarize it. The first one is the most dangerous virus on earth. Take it or leave it. Coronavirus, we use alternative medicine. Wallahi ta'ala isma billahi to cure coronavirus. I can't count the number of people that we are able to cure coronavirus. Even if anyone has it, you don't need to shout. Don't shout. Even if you call me, I will be laughing. It's just like it's something we will do like a joke. Like a joke. Coronavirus is not as dangerous as hepatitis because some doctor may be trying to deny this fact. You can't count the number of hospitals that they claim to have cured coronavirus. Let them come out to say to the world that they have any single patient of hepatitis they were able to cure. No hospital in the whole world, not only in Nigeria, not only in Africa, I'm talking about the whole world. Go to India, go to China, they will turn you back. Go back to your country, go and die. So what we are in Nigeria, there are solutions. This solution I'm talking about may not be 100%, but it will not allow you to die. In Skola Islamic Foundation, the one we are preparing, I want Nigerian, I want developed people, I want everyone who will see this video to understand something. God will bear me witness. I'm not here to announce, to advertise. If I want to advertise, I will show you this is what I'm saying. No. but your health is our concern. If we are talking about the problem of kidney, problem of heart problem of gallbladder, problem of cholesterol on the heart, problem of stroke, problem of eyes, problem of brain seesaw, problem of hearing, problem of stroke, prevention of stroke, hepatitis, hypertension, high blood pressure, problem of diabetes. All those things is something we can give you. Go and use this with guarantee, 100%. Even the guarantee we have to secure the life of HIV patient, we don't have it for hepatitis patient. Because of what? Because of the liver. If you want to do something, if you want to prepare an app, you must consider the liver. Don't say you want to help someone to cure hepatitis B and you damage the liver. If you kill anyone because of the medicine you produce, you are going to account it. You are going to account for it. So this virus is the most dangerous virus. Second one is, it is possible for husband to have it and the wife will not have it. It is possible for wife to have it and the husband will not have it because of some morphological factors. Some factors in the blood morphology that will not allow any virus, any disease to appear. Some people will have they will have malaria. You will see it in their eyes, you will see it in their movement, even their body will show they have malaria, they have jaundice. But test them, you will not see it in the blood. That is how it works. Some people have a very powerful blood, but this blood does not mean the virus will not be flowing there. This blood does not mean the virus will not enter your liver, but they will not see it. That is why the moment you have a sex with someone and the person have it and you don't have it, don't silence, you have it. You may not believe me. I'm not saying this to believe me. And this, if the program does not relevant to you, you can delete it. If you know this can help someone, help us to share it. That is what I'm saying. In the light of this, the third point I touch is that the factors that make it to spread is that it is spreading. You can contacted it not only through sex, so you can contact 100%. If you have a sex with hepatitis, you can't dodge it. You will have it. You will contact it. It can spread through saliva. It can spread through sweat. It can spread through spoon. Even where you are sleeping, it can spread through it. If you have a sweat on your pillow and another person put his head on it, you can contact it. All what I'm saying, if you go to Google and you don't see it, you can call me. My number is there. That is the third point. The fourth point, I don't want the program to be too high. The fourth point is this. I said there is no any medical solution for hepatitis B, and you can't find it anywhere. And there is no any doctor who can come out to say he or she has already been treated anyone with it. They will give you some drug, and this drug is not to cure. It's not meant to cure, but is for your gallbladder, to enhance your gallbladder, to make your gallbladder powerful. What I'm saying, I may not be 100%. I'm not a science student, but no doctor will mark me down. They can say, "Oh, you try. It's okay. I'm okay." Now, what is the solution? The only way out for this hepatitis virus is through herb. Because why? Herbal medicine is the only medicine that has spiritual power. Herbal medicine is the only medicine that have a composition of gathering something that God Almighty produced as a natural resources. Herbal medicine is a medicine that has no chemical putration, no chemical involvement, no conservative, no chemical mix-up. Because some people don't know, if you have hepatitis and you are eating bread, I mean local bread, ordinary bread, I'm not saying a packaged bread, a bread that contains potassium bromate, that will increase your yeast. You are an hepatitis patient and you are eating bread, Nigeria bread. I'm not destroying any market, I'm trying to save life of people. If you are eating bread, Nigeria bread contain potassium bromate. This potassium bromate with hepatitis B virus will make your yeast too high. Originally, your urine will not yellow, your urine will not dark, but it will be like a brownish. It will be like a color of a flesh, and you will be seeing it as if I mean if you mix a soap. You have hepatitis virus and you are taking bread, you are helping it to procreate. If you have hepatitis virus, reduce minerals, especially Coca-Colas. I don't want to mention them because of the chemical inside it. Let me say if you have hepatitis B and you want to live long, reduce all soft drink, reduce all alcoholic, because of the chemical contained in it. It will not kill the hepatitis, but it will reduce the function of your blood. It will reduce the function of your hormone system that's supposed to help you to live long. If you have hepatitis B virus and you are taking alcohol, it will make you to have jaundice. Your eyes will change to yellow immediately, because it will be killing your hormone. So you will allow the virus to be flowing anyhow. There is something in your body system called hormone system. If your hormone is balanced, that hormone will be helping you to resolve some problem. So some people will say, oh, what kind of food are we going to avoid? Reduce bread completely. If possible, don't eat bread again, except bread that you are assured of that it does not contain potassium bromate. Reduce any chemical consumption. Be natural, because your liver is at stake. Your deoxyribonucleic acid that determine your life is at stake. So don't take anything chemical. That is where I will advise you not to take medical medicine. I'm not saying this 100% to accept me. It's an advice. If you like, take it. If you like, drop it. Medical pill contain chemical one way or the other. They may say, oh, this is a herb. This is also a herb. This is, the origination of the herb. But the chemical used to conserve it, the chemical used to preserve it, it's also harmful to your body. You are not as you be. The moment you have hepatitis B, you are not as you be before. You have been reduced in your hormone. Your hormone system has been reduced. Your blood factor has been reduced. That is why they don't need your blood in hospital. That is why they will not ask you to donate your blood to anyone. Your blood is not useful on heart again if you have hepatitis B. So reduce medical consumption, especially a medical pill that contain chemical. If you want to know this, I'm not the one to mention any name. When they give you any medical pill, type it on Google. You will see caution, you will see dosage, you will see what the ingredient they use. They will mention some botanical name that you will not be able to know. Take that botanical name again to Google. You mention a name of a particular drug. For example, my name is Dr. Skola. Maybe I give you a drug name as Skola. Type that Skola on Google. Now said, I don't want to mention any name, so I use my name. Type side effect of Skola. If that Skola is a medical pill, side effect of Skola or reaction of people on Skola, type it on Google. The moment you type it, it will bring the manufacturing date, the manufacturing site to you. Then you read it. Read the composition of that medical pill. When you read it, you will see some of the ingredients. It may be 3, 4, 5. In that ingredient, they will put something like a botanical name. Now take that botanical name again, take it out, go and write it in Google again. What is the meaning of this? Then you write the botanical name. They will mention it. You will see it in encyclopedia. You will see it in Google. When you see that one, they may say something you don't get again. You take it again to Google. That is how we are able to do research on how medical pills are killing people, how medical pills are destroying the kidney, how medical pills are destroying the liver. Doctor has a kind of propaganda against alternative medicine. They will say, don't drink herb. Oh, if you drink herb, it will destroy your liver. If I ask any no doctor can prove it in front of me. I'm saying this as a challenge. If any doctor can come out that a herb, a well-preserved herb, I don't say any herb. I don't say the herb you see on street. I don't say the herb that somebody tell you it can cure diabetes, it can cure hypertension. The herb that can cure hypertension can never cure diabetes, because a diabetic patient, I mean an hypertensive patient cannot, if the person does not have diabetes, if the person use the herb, it will affect the hormone system.